Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Andy H. Wynn, Commissioner Precinct 2.
Here.
Gary Fickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation today will be delivered by Randy Thomas from Lake Country Christian Church. Appreciate you coming out today. After the invocation, please remain standing for our pledges.
Let us pray. Dear gracious God, we come to you on this, your day, a day that you've given to us to rejoice and be glad in it. We thank you, Father, Lord, for your many blessings, and today we count them and we name them one by one. We ask you, Father, Lord, today that every decision that is made today, that you give our judge and the city commissioners the wisdom and the knowledge that they need, O Lord, to see our city go forth, to reach the north, the south, the east, and the west. We pray all these things in your name today, in your precious name. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state under God, one and indivisible.
Manius, agenda announcements.
Thank you, Your Honor. We have only one announcement this morning. That's on the proclamations, resolutions, and presentations. That is item 6B. We're going to hold that particular item for 1 week.
Okay.
Thank you, Your Honor.
Court members, you have before you the minutes of our regular meeting of July the 8th.
Move approved. Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. We do have one proclamation, and it is for Let's Not Do Lunch Day. Bo, come on down.
Let's not do.
And this is for the Tarrant Area Food Bank, who I think we've all been raising money for the last couple of weeks. And I'll read this resolution into the record. Whereas each morning in Tarrant County area, more than 332,000 people, including over 122,000 children, wake up not knowing if day. And whereas the Tarrant Area Food Bank provides donated food to feeding sites that include food pantries, mobile pantries, senior citizen centers, kids cafes, emergency shelters, soup kitchens, low-income children care centers, and other social service centers. And whereas every month, partner charities distribute more than 1.5 million meals to individuals and families in the form of groceries or prepared meals with food provided by the Tarrant Area Food Bank. And whereas on July the 25th, 2014, Tarrant County is asking employees throughout the county to fight hunger by donating their lunch money to the Tarrant Area Food Bank. And whereas each dollar Tarrant County employees donate will allow the Tarrant Area Food Bank to distribute food for 5 meals to our neighbors in need. Now, therefore, be it resolved that we, the Commissioners Court of Tarrant County, do hereby proclaim Friday, July the 25th, 2014, as Let's Not Do Lunch Day in Tarrant County. In witness whereof we have herein to set our hands and cause the seal of Tarrant County to be affixed this 22nd day of July 2014, and I'll move its approval.
Second.
Motion second. Please vote. Motion passes unanimously. We don't have a camera? We don't have a camera? We do now. We got it? Isn't it amazing what technology will do? Thank you.
I was reflecting when I was sitting back there with, some of you probably know Ann Farmer.
Just a little bit.
Just a little bit. I was reflecting on the fact that I've had the privilege of being director for the food bank for 17 years now. Time has gone remarkably quickly. And there has been a couple of constants in our life over those 17 years. We have tripled distribution. We have reached more people. We have met more challenges. And we couldn't have done it without the support of our public, our constituents, and your constituents. It's been a while since I've been here, so I really want to thank you both for what you're doing right now and what you've done in the past. I think that this is probably one of the things that makes me the proudest of Tarrant County and the proudest of people who support us. This, as you refer to, public-private partnership that works so well to meet the needs of those who are hungry. We've had a fabulous year at the food bank. We continue to have great public support. We are in the process of wrapping up the first phase of a capital campaign that will allow us to almost double distribution again. And I'd like to personally invite all of you to come to the food bank on September 25th when we have a groundbreaking as the first step in this project. Thank you so much, and I will do what I always do. I'll just turn my back on you. I can do it with impunity, right?
That will be fine.
Thanks to all of you who are employees, staff, supporters. You know, what you tell the public when you do this is that you love them, you care, and what you're really doing is more than just raising money. You're giving hope. You're giving hope, you're giving compassion, and you're showing the community that not only are you great public servants, but you're also very, very, very loving of those you serve. Thank you so much, and I hope you have a wonderful summer. And now I'm going to call on our board member, Ann Farmer. She's shy, but she'll get over it.
It was sent to their office, a lunch sack. Most of the county employees are going to receive one of these on Friday for an anonymous donation. If they don't receive, or you do not receive a lunch sack, you can donate in any commissioner's office, in any Tarrant County Credit Union office or location. And if you can't find a place to donate, call me and I'll come get it.
Here you go.
I'm sorry.
Oh, good.
How come we got those color? You got those different
Well,
colors?
these are the ones from our theme of Hunger Never Takes a Vacation.
Okay. Well, this is we'll go. No,
Okay, thank you. We appreciate it.
don't mix that in and give it to somebody now.
Judge, thank you for your commitment and support of it already. Lunch with the Judge went for a high price last Friday on our auction, and there was spirited competition. So he's generously said that he'll donate another one. Anybody?
And I will. I'll just say I know we had the little friendly competition of which I don't think you bought our lunch yet.
I did. You were just not there.
Were any of the rest of us there, or was this a lunch that you privately had by yourself?
I have the receipt to put it on.
He doesn't remember it. He says. I think you're out of luck.
I've been in politics way too long.
We have, through the work of my staff, and not from me, but we've raised about $1,300 so far for the area food bank. So, I just encourage y'all to. We might start a little competition on that next year.
Anyway,
So.
thank you so much. We greatly appreciate it.
Thank you, Bob.
And can I recognize Ann? She's fabulous. She's been a long-time board member.
Court members, you have before you the consent agenda.
Move approval. Second.
You have a motion and a second to approve the consent agenda. Any discussion? Please vote. Motion passes unanimously. Mr. Manius?
Thank you, Your Honor. Members of court, we have one additional item to bring to you today. We're requesting that the Commissioners Court award RFP number 2014-101, which is the financial audit of Tarrant County government, to Deloitte & Touche, subject to the successful contract negotiations.
Move approval. Second. We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you, Your Honor.
Thank you. Mr. Phillips, thank you for getting the air on yesterday. May have been a little late, but we appreciate you getting it on. It was cool by mid-morning.
Thank you. Mid-morning's good. It beats noon.
Yeah, it did.
It's requested the Commissioners Court approve a construction management pre-construction services contract with Spar Glass Contractors for the Precinct 1 Maintenance Facility Project.
Move approval. Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Good morning.
Good morning.
Good morning. Good morning.
We have 4 items for the court this morning. The first item, we're asking the court to receive and file the personnel agenda.
So moved.
Second.
We have a motion and a second to receive and file the personnel agenda. Any discussion? Please vote. Motion passes unanimously.
Our second item, we're asking the court to approve a waiver of terminal benefits for elections. The chief bookkeeper retired at the end of May with 400 vacation hours. Elections is requesting a waiver of 104 of the 400 hours, effective tomorrow, 7/23. We're looking at net savings to the general fund of a little more than $2,100, including fringe benefits.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Third item, we're asking the court to approve changes to the table of organization to public health. They're requesting the addition of 2 new positions, as explained in your court communique. One is a DSRIP, or position to be funded with DSRIP monies, a health educator who will be involved in prematurity prevention. The second position is an epidemiologist specialist who will be involved in investigating foodborne illnesses. Both, again, well, the second position is funded with state grant funds. Neither position will have impact to the general fund. We're asking that both positions be added 7/23 tomorrow.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
I left my mind on the beach in Jamaica. It'll be back in a minute. Fourth and final position, we're asking the court to approve an out-of-class pay extension for JP1. They have an employee who assumed the duties of the court manager back in February. As the court knows, our policy allows employees to receive out-of-class pay for a 90-day period. And so that began in February, went through the end of April. The court has granted 1 extension that will take us through the end of this month. The JP is asking for 1 additional extension through October of this year.
Move approval.
Second.
We have a motion and a second. Any discussion?
Yes. Why have they not filled this position?
Commissioner, I believe the position I know that the position has been posted. I think the JP I think it's taken him some time to go through interviews. He has 1 individual.
6 months?
He has 1 individual, the individual that's assumed the responsibility of the court manager, and I believe there's interest in having her fill the position. And so I think he's trying to determine with this additional 3 months if she will be the right choice for the position.
Any other discussion? Please vote. Motion passes 4-1.
Thank you.
Thank you. Chris. Yes, sir.
Good morning, Your Honor. Court members, we have before you this morning 1 item for consideration. It is requested that the Commissioners' Court approve the tax share prosecutor implementation agreement and authorize the Conference of Urban Counties CUC payment in accordance with approved project payment schedule. That payment schedule is July 2014, October, and December of 2014.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Thank you, Chris. Mr. Beecham.
Your Honor, the members of the court, we'd like to welcome Robert Early to our side of the courtroom. We thought he was just been left-handed all these years, but we do have 3 business items for your consideration. Our first item is a bid award recommendation for RFP 2014-115, RFP for interpretation services for the deaf and hearing impaired for CSCD. Recommendation would be toward per the contract terms. Selecting as our primary vendor, Hired Hands Incorporated, and our secondary vendor, Language Consultants Incorporated.
Move approval. Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Our second item is also a bid award recommendation for bid number 2014-131. This is an annual contract for the purchase of warehouse boxes and lids. Recommendation would be toward a per enterprise basis. Selecting as our primary vendor, Greenwood Office Outfitters, as our secondary vendor, Accurate Forms and Supplies.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Our last item is also a bid award recommendation for bid 2014-135. This is our annual contract for the purchase of 6,000-pound capacity diesel-powered forklifts. Recommendation would be to award on a pre-enterprise basis, awarding to the low bidder, Equipment Depot, the amount of $26,761.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Randy, come on down.
Good morning, Judge.
Good morning.
Good morning. We have 2 items for your consideration today. Our first item, we are requesting the court's approval of an interlocal agreement with the City of Fort Worth related to improvements to Norwood Drive. This project will be funded through Precinct 1 and Precinct 3 discretionary bond funds.
Move approval. Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Second item, we're requesting the court's approval of an interlocal agreement with the City of Hurst related to an intersection improvements at various locations throughout the city. This project is included in the 2006 bond program.
Move for approval. Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Okay, Commissioner Brooks, I believe you and Commissioner Johnson both have items.
Yes, Your Honor, I'd like to move approval of the interlocal agreement between Tarrant County Precinct 1 and the Everman ISD, the companion item, which is permission to start.
Move for second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Commissioner Johnson?
I'll move approval of item 8M2, A and B for the Lake Worth ISD.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Are there any appointments today? Being none, then we'll move on to the claims, including the addendum.
Move approval of the claims, including the addendum.
Second.
We have a motion and a second to approve the claims, including the addendum. Any discussion? Please vote. Motion passes unanimously. Briefing items, Mr. Manius?
Thank you, Your Honor. Members of the court, we have one item to bring to the court this morning. That is the monthly update from the hospital district. We do have a PowerPoint. We've also laid before you on the dais a copy of that PowerPoint. Mr. Early is here to address the court at this time.
Thank you, members of the court, Judge.
Good morning.
Good morning.
So are you moving to the right on us?
Well, no, really what I did is nobody ever sits next to Jack, and I felt bad for him, and so I sat next to him. And I try to help him out when I can, but that's a challenge.
It's
I know.
a challenge that we've borne for many years.
I understand. I understand. I'm in the whirlpool. What I wanted to do is we have had a variety of changes at JPS, and I think one of the areas at JPS is the most dramatic is our ability to collect data that we are validating and feel comfortable with. We've always had a variety of statistics and numbers, but not necessarily able to validate it in the manner in which we want to validate it. So what I have for you is just a snippet of information, and what we're going to try to come up with, which was a suggestion by many of you, and recently by Commissioner Wynn, which I appreciate, and that is, what is it that you as a court can look at and say our hospital district is functioning in the manner we want it to function in? What is it that you can justify to your taxpayers and your constituents and say, I've looked at what JPS is doing, and I think these are situations that put us in the right direction, as opposed to anecdotal comments that people might make or stories that may happen here or there. What is that test that looks that you can look at and see what JPS is doing and how we're doing it? So a couple of things that I have for you. One of the things, what do I need to do here, Mr. Manius?
You're there.
There I am. First of all, these are just some stats on what JPS is. It's a 537-bed teaching hospital.
And stop right there.
Yes.
I'm glad to see that you have embraced the fact that you are a teaching hospital.
Exactly.
And you're willing to claim it loudly and proudly.
That and the fact that there is no aspect of what we do that we're not interested in telling people. There's no hiding. There's nothing. We are a proud teaching hospital, and we do well at teaching. And that teaching effort not only helps us become better, that's an economic multiplier to this community. We bring jobs to this community. We just don't make people healthier. We bring jobs to that because about 71% of those people that we teach in our various teaching elements oftentimes stay in the North Texas region. So it's a big factor, and I've heard you made that comment, and we've done that. We've addressed it, so thank you.
Thank you.
To give you an idea of just our hospital admissions, what we're looking at, what you're looking at inpatient and outpatient surgeries, day surgeries and inpatient surgeries. We do 14,000 total surgeries in a year with 12 ORs. If I could turn back the hands of time when they built the new expansion to JPS, instead of putting in the same exact amount of ORs that they had from the old facility to the new, I would have put double that. I don't think I would have had 12 ORs. I would have put in 24 ORs. It's probably what we need for that kind of volume. Not many people do that kind of volume. We have 977,000 outpatient visits, 19,000 behavioral health visits. No one in this community and very few outside of this community are going to match what we have in behavioral visits. To give you a perspective on the emergency department, when I first became the interim CEO, we were looking at close to 145,000 75,000 emergency department visits. We're up to 105,000. 17,000 behavioral health ED visits. We're down slightly on our bursts, but so is everybody else. And I think that attributes to a variety of things, including the economic climate that we went through and the nation went through in the past couple of years. So bursts are slightly down. We've really been averaging about 6,000 bursts. We're down slightly in that. And that's just a comment for you about what JPS is regarding its Level 1 Trauma Center. Did I click the wrong one? Yeah, go.
If you need us to go,
there.
We're having trouble with our deal here. Just tell us when you want us to.
You're kind. I think it's me, actually. It's my motor skills, but thank you for helping me.
I wasn't going to say that.
Yeah, I know you weren't, but thank you. This just gives you an idea of our clinics. We have 62 clinics in 42 geographic locations. Some of those clinics are actually located in our hospital, so they're scattered around. Some of them are small. I think the key number right there is 15 primary care clinics. If you look at the future of JPS and where JPS needs to be strong and what JPS needs to deliver to this community more than anything else, it's primary care, and it's 15 primary care clinics. If we fail in primary care, if we fail in getting individuals a primary care doctor, all you'll see is the need for an expanded emergency department. And if you put $52 million into an emergency department, I can guarantee you need to put $52 million more and $52 million more. I've made that comment before. It's not to say that we don't need any additional funds for an emergency department, but that is a real challenge to constantly put money in. You've got to figure out upstream care. And upstream care is getting people a primary care physician and getting them into some type of regular setting. That's changing the attitude of individuals. It's trying to figure out how we make access available. If you don't have access to primary care clinics, you're going to go to an emergency room. If you have to wait 30 days, you're going to go to an emergency room and you're going to get your care. That's where JPS can score major victories in the future. That's also part of our effort in our partnership and our relationship with the University of North Texas Health Science Center, who out of those 15 primary care provide us the physicians for 11 of them. 4 of those clinics are JPS clinics where we do our resident training and teaching. So that partnership to put everybody on the same program of performance and the same levels of direction will make huge differences to this community. If JPS fails with its primary care, its emergency room will constantly be inundated and you'll have a block system.
Robert, what is your target for length of time that it takes to get an appointment in one of your primary care clinics?
We started out this year with a staggering about 100 days. We've now gotten it down to 32 days, and our goal is to get it to 14.
14 days.
Yes, sir. And we're moving in that direction. We've gone from 100 plus to 32, which we've maintained for the last 3 months at 32 days overall, and we're getting it down to 14.
What's going to get us over that last hump?
I think looking at utilization of nurse practitioners, also making sure that we're fully staffed, and making sure that we are able to better manage. One of the things that I mentioned to Commissioner Wynn that we've had a challenge with is if you show up at one clinic and we're inundated, getting you to the next clinic and letting you know what that schedule is, being able to be a traffic air controller and say, you know what, Azle is not that far, this clinic, or go to this clinic, you could probably get in today. The other thing that we've done is an open access model by which you show up at the clinic, and if you don't have an appointment, we have scheduled abilities to get you seen that day. We have a welcome clinic now where people can go in directly and get seen that day. So those are efforts to do that. Also an emphasis on urgent care. You start getting people out of the emergency room. Having a designated area for urgent care makes a big difference as well. The rest are just some kind of statistics for you, and I'll go through these briefly. If you go to ED patient access, there's a lot of numbers up here, but what I want to indicate to you is JPS's average time to triage you. If you come into the emergency room, the average time to, no matter what you hear anecdotally, statistically we can show you, is 8 minutes time period by which you will be triaged. Now, that's a great situation for us to get you 8 minutes of immediate triage care. Where the challenge and the criticism comes is we've got limited space. So what we're going to do is we're going to bring you into our emergency room. We're going to triage you immediately to figure out what your level of care is needed. If you're an emergent patient, if you are in an emergency, then we're going to move you back as quickly as possible for the health for your health and your safety. But if you're there because you're not an emergency patient, you're not even an urgent patient, then you are going to wait because we're going to establish those priorities. And we've got a fantastic emergency department crew now who's making those decisions. And if you're the person that has to wait, you have a stomach ache or you don't feel good, that's important to you. But it's hard for you to understand the person who's there who's got a loss of blood or is seizuring or whatever the case may be. That's going to be our first priority.
Does the triage process include diverting people from the emergency room to the urgent
care? Yes, it does. And we've grown our urgent care from just a few thousand now to 62,000 patients in a year to our urgent care facility.
We only have one urgent care facility?
We have one urgent care facility. The other thing is, in the not-so-distant past, the emergency room was always the facility you went to either on weekends or after-hours type situations. It's a 24/7 situation now. It's not just an after-hours kind. The other thing, it speaks to my point earlier on the importance of those community clinics in primary care. In the old days of JPS, the old days being 9 years ago, and I mentioned this to you all before, but we had a secret shopper program, and we were referring people from our clinics to our emergency room. And that's not a process, not only do we not do anymore, it's not a process that's effective and efficient for your system. Now, the one I want you to call your attention to on this is the last chart, and that's boarding hours. Boarding hours are our challenge, and they're the challenge of every emergency department. We're only so big, and we only have so much room. And the room that we need is an admitted bed inside the hospital. About 80% of those that come through the emergency room are admitted patients at JPS. The challenge that we have is trying to get you out of that emergency room and get you into a bed. So that keeps an incredible stream of care that we need to do. We need to be more efficient with your length of stay. We need to do more efficiencies with our discharges. We have a couple of problems at JPS. We have people that have historically said, your discharge time is 10 o'clock. We're discharging you today at 10 o'clock. Patients oftentimes will say, I have no transportation. I can't leave. My daughter can't pick me up till she gets off work today at 6 o'clock. Traditionally, JPS has said, okay, stay in this room until 6 o'clock. We don't do that anymore. Now we have a discharge lounge. We have a place to take you out of that room, put you in a facility, put you downstairs in a lounge, in a comfortable chair with a television, and you can stay there until your family members or your transportation can get there. That's been a big factor. We also got into a trend of discharging only at certain times of the day. Well, that's not right either. You don't just get better at certain times of the day. When your time to leave is your time to leave, we want to discharge you at that time. And that's where our hospitalists are now being very important to create discharges throughout the day, just not at 10 o'clock and 12 o'clock. So that's been an important factor for us. But if your boarding hours continue to be a challenge, we can't get you out of the emergency room and get you into a bed, it's going to backlog the entire system. And that's going to create longer wait times. The other thing is, the last one I'll make mention to is the left without being seen rate. What you see here is pretty much a constant trend. We're trending downward on our left without being seen. In May, we were at 5.2%. In 2008, when I became the interim, and this truly is not me, it's a team of people that have done this, but in 2008, the first month of being the interim, our left without being seen rate was 21%. That would equate to 15,000 people a year leaving the emergency room at JPS going somewhere else, predominantly Baylor and Harris, down the street. So to have it down to 5.2, and for 3 years we've kept it pretty much in single digits, that's a huge improvement with the increased number of people that are coming in. If you'll go to the next one. This is overall perception of care. These numbers might look to you and say, boy, that's not as good as we'd like for them to be. We're trying to get to the 50th percentile, which is the solid line at the top. Now, what is interesting about this is, and this graph is somewhat deceptive, because John Peter Smith himself, the man, probably started doing ED perception, and our numbers have always been in the first percentile. We've been in the first percentile since the beginning of time. And we stayed in the first percentile since the beginning of time. And the reason that no one knew about it is we didn't calculate this. So we would tell you, we're doing fine, we're doing great. Well, now we're going to show you where we are, and right now we're in the 42 percentile. We are still VTACing. In February, you see we were in the 4th percentile. We've been as high as the 89th percentile. We're continuing to kind of rise up and down. That shows you not only improvement, but now we need to create consistency. And the problems of where we don't have consistency and where your perception of care, and again, this is just the perception. It says nothing to do other than how did you feel about our emergency department, and we give you a survey. Where we're down and where we're low is going to be, I can guarantee you that those times where we're the lowest, our boarding is the highest. When your boarding's the highest and you're overcrowded in your ED and you can't move people out, you have people waiting way too long. And waiting in an emergency room is a tough place to be. You hear everything, you see everything, you're next to people that are even sicker than you, and it's a challenging place to be for a long period of time, or a longer period of time than we like. So I am pleased with the overall perception of care. I'm not pleased with the fact that we continue to VTAC, we continue to go up and down, but I think you're not seeing any more first percentile rankings. We are constantly moving in an upward direction. And our trend is a little flat right now, but we're tending to get better and keep them up into the 50th percentile, which is where our goal is. The last one is, I realize, a little bit confusing with the number of lines there, and if you're colorblind, it makes it even more confusing. So to me, it looks like a beautiful white and gray chart. But they tell me at the office that it's not. But what I want to do is, if you look at four major indicators being AMI, which is heart attack, heart failure, which is your HF, your pneumonia, and your surgical care improvements. Those are a series of indicators in surgical care. That's your skip measures. What we did was we looked at hospitals and we compared ourselves, not to hospitals that are like us, but we compared ourselves to the top 10% hospitals in the nation. And that's the top graph that you see there. That top bar, whichever color that represents, the top one is the top 10% hospitals in the nation. If you look below that, you'll see where the top 25% hospitals are trending. If you look at the big, large bar graphs, that's JPS, and you see our dotted trend line. We're improving. Right below that, what you will see is where the national average is. You actually see Texas. Texas is the next one. You'll see Texas hospitals. And again, those are all hospitals. It's not selected to just who looks like us or size. It's every hospital in the state. You'll see where Texas is trending. Then you'll see where the national trend is. And the last list on there is your government non-federal hospitals. There are different public hospitals throughout the state, and they qualify them, the nation, they qualify them differently. That is as close as you can come to what the Federal Registry gives to what is a public hospital. So your last graph on there is nationally where public hospitals are charting. I'm proud of where JPS is, and I think it's doing quite well in those four major categories, which are oftentimes going to be what you're looked at for your performance. That's where JPS is. So I just wanted to give you a snippet of some of the statistics. I'll be happy to show you, and I'll come to meetings in the future which will give you more details, some of which we're doing well on, some of which we need help on, some of which we're doing stellar work on. The other thing I thought is, and again, we're going to go back with staff and look at what you as commissioners can look at and say, these give us an indication that JPS is doing average, JPS is doing poorly, or JPS is doing well. I think that's fair for you, and I think that's fair for your constituents to get to that level and give you an idea of where we are on those. So I apologize for going a little bit longer than I usually go, but I wanted to give you some, and I want to thank all of you. I want to thank Commissioner Wynn for looking through some of these and helping us with some of the analysis that we've provided here so that we can statistically show you what we're like.
I have one question. We have over 105,000 emergency room visits on an annual basis.
Yes, sir.
We only have 15 primary care clinics. These clinics are the key
yes.
to preventing people flowing to the emergency room, which has been causing a bottleneck.
Yes.
Right?
Mm-hmm.
That's where the bulk of the problem is. With the increase in population in the next 10, 15, 20 years,
mm-hmm.
I'm talking about from 1.9 to maybe 3 million people in Tarrant County. 15 primary clinics, I don't think that will be enough. Mm-hmm. What is your anticipation in how we deal with the expanded, ever-increasing demand? How do we, is there a plan in place to anticipate these changes and be able to rise to the challenge?
To answer that question in simple form, yes. And one of the things will be the pilot program and the experiment that we're doing in your precinct, and that's what we do with the medical home model that we'll be creating there. And again, that's an industry buzzword, but it's to create a better center of care for 360-type care in the hope of providing greater access. 15 is a number. Access is the key. Are we getting people in, and are we getting care delivered to those people in a manner in which they don't have to necessarily go to the emergency room, as I spoke to? We need to be more efficient with the 15 clinics first. That's step number one. Step number two is begin to look at the demographics and see where those changes start occurring, and looking at the possibility of where you put additional clinics and where you combine clinics for greater efficiency. Not because you want to cut, but where you want to make it more efficient for folks to be. And with that efficiency also comes putting them in your projected zip codes of where you're going to have more people use your clinics and where your preponderance of a JPS patient base is, as opposed to just putting it here or here outside of a zip code that is a high-use zip code. And so some of that's projections. The other aspect of that is trying to figure out the additional funds and the additional money that it would take to do that. Oftentimes people want to donate facilities to us, which we're happy to have, and we appreciate that. The donation of the facility is the first step, but the harder step is the FTEs and what it takes for long-term to try to figure out how to make sure that we maintain the employees to run that, the physicians, the nurse practitioners, and the staff, and then what kind of services you put there. But all of those are things that we're looking at. To answer the last part of your question, 15 is probably not enough, but it's harder to answer because I don't think we're efficient with our 15 right now. If we were at peak efficiency, I could answer that question.
And one of the other things that I would say to that is that I think we need to qualify the folks for Medicaid or for that, and then hopefully the primary care physicians in the communities will take Medicaid-type patients, and we don't end up spending all of our tax dollars on primary care services. We end up spending it, we spend the limited amount of dollars that we do have on the surgical and on some of the things which, if JPS isn't around, we know those are going to end up at the not-for-profit
right,
and the for-profit hospitals from that perspective. So I think we have to be very careful
of the balance
of balancing that, because a lot of our primary responsibility, I believe, is that hospital facility for the indigent, and then hopefully we collaborate with some of the private primary care physicians to help with the primary care clinic type facility and that type of.
Well, the other thing, too, to your point, Commissioner, and you're right, you have to have that balance. The other thing is, as our population increases, so do your psychiatric and behavioral patients. And those patients there are private facilities, but from an emergency room standpoint of a psychiatric patient, we're the only ones in town. So when that population increases, and it will, we need to be there. We have to be there. We're it.
Well, and you are, because you're in charge of the largest mental health facility in the county, and that
which is the county jail.
County jail.
Well, exactly, and that was the other part that I want to talk to is the correctional health aspect. So as those population increases, all those areas, particularly the areas where there are absolutely no alternatives, and it is just JPS, we have to be conscientious of. So I think it's proper planning, it's proper thought, and the first step in that direction is to identify these. We have not been able to identify them very well in the past. So it's identifying them and being smart about it. It's a good question.
The collection of data will help us make decisions more intelligently.
It will.
That's good. That's great.
No question.
Thank you.
So I apologize for my extended time. I didn't mean to do that. Usually this is just Jack's responsibility to take up your time, but I didn't mean to take it all up today. So
Thank you.
Thank you. I appreciate y'all's efforts very much.
Thank you, Robert.
Thank you, Robert.
Thank you.
And what's the status on we saw folks on TV last night, I guess, with regards to, what can you tell us about that?
Okay, well, Cyclosporasis is the issue, and we were trying to get the word out to the providers primarily, because people come into their offices possibly complaining about diarrhea, but they don't test for this bacteria. And so we're trying to get the word out. Seems like it always increases in the summer. We've not been able to find a reason, one common source for it. And so the messaging to the providers is check for it if someone has had prolonged diarrheal symptoms, as well as nausea, vomiting, and so forth. And then to the public is wash your produce.
How many cases do we have here?
We, up until the last 30 days, we had only had one case. And then it went to 8 cases real quickly. And so that was what signaled our move to get with the providers. Also, the state has had more cases. They had only had 8 up until the last 30 days, and they've had 61. So it's across the whole state of Texas. But the message is the same no matter where people are. And things that are difficult to wash or people might not think about washing, such as prepackaged salads, and then the herbs that people buy that are bound together, especially there's been a history with cilantro before, and then certain types of lettuces. And so we just want to get the word out to everyone, and we've been very fortunate to have good media coverage to get that message out. So just encouraging everybody to wash their fruits and vegetables.
Fruits and vegetables.
Yes, sir.
Even if it's prepackaged or whatever
Exactly.
the case may be. Just do
And
it.
I realize that they do say pre-washed, ready to serve, but you never know. And since it's on the rise and we don't have a common cause, last time this happened last summer as well, and they never were able to track it to anything. So it's just better to be safe than sorry.
Okay.
Any questions?
Thank you very much.
Thank you.
Anything else?
Not at this time, Your Honor.
Then we will recess our open meeting and proceed to close to discuss items exempted under
Really?
We're ready.
Having returned from our closed session, we'll now address the following matters.
Thank you, Your Honor. Under item D1, District Attorney's Office, we're requesting authorization for the Tarrant County Criminal District Attorney's Office to intervene in the cause of action that's stated in item D1.
So moved.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
That's all we have at this time, Your Honor.
There being no further business, we're adjourned.